Okay, in this video, I'd like to go through this clinical support by body system, explain how it's structured. So if you have a look, you start off from the head end and then you work down the body. Pediatrics related to women's health, dermatology, MSK, cancer palliative care and laboratory investigations. Then if you click on any one of these, then the subdivisions will come up and that applies to all of them. Men's health is in one section. However, with women's health, that is subdivided into multiple sections. Sometimes this can make it easier to find things, and sometimes it can be just a little bit more tricky, whereas men's health can be easier because, as I said, everything's put together in one section. This is important. So we've got your hematology, biochem, microbiology, and just look at this section, general. Anything that doesn't fit into these clinical categories, I put it under general, so maybe the DVLA stuff would be there. So please remember this little corner there. So what does it all mean? How does it work? Let's look at, for example, ophthalmology and ENT. We see it quite often, it's bread and butter. So when you press any of these sections, it brings you on to here. This is the anatomy of our consultation as to which part of the body, what diagnostic tool do we use, what's the local pathway that we need to diagnose or treat whatever it is that we're doing, how does that compare to national guidelines. We may want to look at that in our own time. What medicines do you need to prescribe for that illness? Is there a shared care drug? Is there any drug monitoring involved with that? Do you need to refer that person? If so, where? Do they meet the referral criteria? Do you need any special form to do it? And then what service do you need to refer to? Do you want to give out a patient information leaflet? And are there any useful websites that you want to refer the patient to or to have a look at yourself? So let's have a look at for ear, nose and throat. What have we got in terms of anatomy? Right then. Let's look at two pictures. I just want to show you how good these pictures are and how they help patients. Can you imagine if a person's got deafness and you show them this picture, they actually understand what's happening, or with earwax. Another good one I use very commonly is when people come in with nine-positional vertigo, explaining how crystals go out of place, and it just makes sense. So then when I'm giving them the Cawthorne Cooksey exercises or doing the air please maneuver, they tend to understand what's happening. But it's not just to do with the ear. Of course, we've got polyps, gluey. They're all pretty good pictures. Right. So where were we? Ophthalmology, ENT. So we were looking at diagnostic tools. What might we need for ENT related problems? Centaur score. Any local pathways related to ENT? So your allergic rhinitis. Let's look at the deafness or hearing loss pathway. So you just scroll over the pathway itself and it will come up. And patient information sheets, pictures. So we've looked at local pathways, then national guidelines. But for example, let's have a look at ENT clinical knowledge summaries. And I know that there are some doctors who tend to use it quite often. Let's look at Bell's palsy, shall we? Scenario management and advice on treatment. Medicine information. Let's see what prescribing guidelines there are for ear, nose and throat conditions. So let's have a look. I know dental infections go to dentists, but if they do come to us, what's the advice and what we should give? Dental infections, and that will take you straight on to what we are advised to give. But of course, we're going to tell them to go to the dentist. Referral criteria. Did you know there was a community dental service home visit? BPV clinic, IFR. What services have we got for ENT in Barnsley? Let's look at equipment adaptation sensory impairment service. So what that service offers and what what number you can ring, and there's more information there. Patient information sheets. Let's see BPPV, and just print it out. And useful websites, British Tinnitus Association, and laboratory investigation. Because we often think about ENT or gastro, whatever, but how have I done this? So say, for example, if you click on biochemistry, it's mainly local pathways and guidelines where things are. And for example, what bloods to do in chronic fatigue syndrome, hyperkalemia, hypercalcemia. If I just press, it'll give you an idea of how comprehensive these guidelines are. They're actually from Sheffield, but we've had a word with Dr. Straffen, and she said it was okay for us to use them because they're local enough and they're just so amazing. And all we've done is that we've put the Barnsley biochemistry number on. So let's just have a quick look what kind of things there are. Hypercalcemia, hyperkalemia, hyperlipidemia, hypocalcemia as well, vitamin D guidelines. So that will talk about the referral for lipids, hypomagnesium, hyponatremia, one I use fairly often. It's amazing. When is it serious? When you need to monitor it more quickly? When you can afford to give time? What drugs can cause hyponatremia? Make sure the glucose and protein's okay. Doing about urine osmolalities. Many times we don't do it because we don't know how to interpret it, but this one does tell us that. And along with, let me just go back to the biochemistry. So like with biochemistry, if you look at hematology, then same thing. If you go into local pathways and guidelines, now let's have a look. Rotherham hematology top tips, that's quite good. It's very brief. So it gives you a rough idea of when to refer for various conditions. But of course, we'd be referring to our local hematologist. And there's one that you probably aren't aware of. Look at this, Barnsley Hematology Services and Tests. So it gives you an idea of what is actually available in Barnsley, what bottles to use, critical results, tumour markers, problems with ice, about that blood transfusion, when to actually refer urgently, when we can wait a while. I could just go on and on because I just want to share it all with you. I'll stop there. So I say that was all there. Go into them. Or the other option is you can go into local pathways and guidelines and choose microbiology or hematology. Okay. So I hope this has shown you how to use this part of the website, and there is a wealth of information there. It's like Aladdin's cave, and the more you use it, the more you'll find out. I mean, it is intuitive. If you notice, even the colours are supposed to match what things represent. Green for a calm mind, red for red eyes, blue for fresh air, yellow for lipids, green for bile. If you're not sure, then the other way you can do it is you can put something like tinnitus at the top, and the pathway will come up, the surveys, best talks will come up. If you want to just give a leaflet to a patient, so I just go back. Right. The other way is if you're not quite sure where to look for what, you can go through things via here. Say, for example, if I just wanted a picture of something and I didn't want to go through it the other way, I got straight into this anal fissure one. It's so useful to show that to patients if they come in with rectal bleeding and we know that it's nothing else and the history fits. The one I find really useful is using it for MSK when you're explaining sciatica, explaining why they're getting the pain lower down. Tennis elbow is another good one I use. When I'm referring patients for foot problems, so looking at the names of the bones of the foot. And then there's also carpal tunnel, explaining why the nerve is being compressed and why then they've got pins and needles. Hip arthritis, explaining why they're getting pain in the hip if they've got x-ray changes. I think that one of the commonest ones I use is knee arthritis. Look at this man. So when you've got your x-ray result of decreased joint space, and when I explain it using this particular picture that, doctor, now I understand, now I know why I need to lose weight. I use it for, trapezius muscle, etc. Whichever one it is, you just press that and then you just wait. And when you've finished with gynae, then again you just click that and you can go on to any others that you want. If you don't click one, then all of them will be there. They've got about 140 pictures on. So what I've shown you for anatomy, the same thing applies for all these others. You click on, and then on the side there'll be a list of clinical systems to get what is specific for what you're looking for. Do you know why I've done it in so many different ways? Because I know that different people search for things in different ways. So what I was trying to do, I guess, is just cater for as many people as possible. People who are more visual, who prefer the colour and the icons, they can use that. But people who are more logical might want to use this. People like me sometimes who don't have a clue, might just want to search. But as I say, even if you don't necessarily use the information that's on here or here, then at least my advice is try and use these top tabs, because you'll find a lot of information that will make your work a lot easier without having to ask other people, without having to look up things. And remember, it's not just when you're consulting patients. I mean, all these national guidelines and local pathways and shared care guidelines, we can use it for when we're doing our CPDs and appraisals. So that's the end of the main body of the website.